staying still on the COVID-19 theme, and there were some questions asked about how do we manage anxiety and well-being among the healthcare professionals in COVID-19 pandemic. Dr. Faye Coster, who is one of the clinical psychologists at King's, she's going to address that. I just asked Faye to do yesterday and give this talk yesterday. I'm extremely grateful for Faye to putting this talk in less than 24 hours as the faculty who, the speaker who was supposed to do the talk was unable to do that talk. So I'm grateful for Faye to doing the talk such a short notice and addressing how do we manage anxiety and well-being among the healthcare professional in COVID-19 pandemic.
Hi. I'm just trying to do the screen. Oh, there it goes. Not only have I just written this in 24 hours, I'm also using a new program on my computer, so bear with me. Hi. So my name's Faye Coster. Thank you very much, Atul, for inviting me to speak here. I'm going to just go through some tips on how, staff members, so that would include people who we manage and also ourselves as well, can perhaps sort of manage some of the very understandable high levels of anxiety that are around at the time and maintain their well-being. So it's going to have two parts to it. The first part is more going to be looking at how we manage staff well-being as a group. So that would more be about what structures we need in place. But then I want to have, for the second part, because obviously we are individuals as well, just have a bit of a focus on how we can look after ourselves and what advice we might be able to give to our peers as friends as well as colleagues. And I almost don't feel like I need to ask this first question. I'm sure we're all so very aware of why it is so important to have strategies for managing staff well-being at this time. So as we know, when there are significant infectious outbreaks, the health service staff, particularly the staff on the front line, will be experiencing extremely high and sustained levels of stress. And we know a lot of this from various outbreaks in the past. In particular, just a bit of research from the SARS outbreak of 2003. And these are actually quite conservative figures compared to some of the other non-reference stuff I was also finding. Like roughly a third, give or take a few percent, of staff were reporting significant distress during the outbreak. 2/3 had concerns not just about their role, but their own health or their family's health. And 29% had significant anxiety over the cut-off on certain anxiety measures used, and that actually increased to 45% of the nursing staff. And subsequently, 10% of staff continued to report high levels of anxiety that were potentially indicative of a post-traumatic response. We know that the high levels of distress tend to be associated with a number of things. One would be direct contact with infected patients, so as has been reported a lot recently, those on the front line. How long the crisis will last will have an impact as well. And of course, staff are also individuals with their own families, so actually knowing in your personal life friends or family who have contracted the disease is also a stressor that will affect people working with patients. Living with small children has come up as a factor on why actually staff members might be experiencing high levels of stress. The extent to which sort of normal family lifestyles and daily routines would be affected by the outbreak would be a factor. And also really sadly as well, feeling stigmatised as a healthcare worker. And unfortunately, I know there have already been reports in the press of some NHS members of staff having negative reactions as being seen as potentially infected. Okay. So obviously it's really important to look after staff. So there was a very recent attempt to do this by I think one of the largest hospitals in the Yunnan province. When COVID was beginning to take off over there, one of the hospitals set up a all shiny psychological support service. It was multidisciplinary with various psychosocial professionals, and they're offering a range of staff support activities such as a staff online courses on how they could manage their own distress. There was a telephone support service. There were group activities, but it turned out that actually staff weren't wanting to attend or take up these services. There was a survey looking at why this was, and staff were actually highlighting that really they felt some of the issues they were facing day to day were more situational and practical. So understanding how to use a PPE safely, how to cope with patients who were showing their own emotional distress. And the staff were actually saying, we don't actually think psychological support is needed for ourselves. So the hospital changed their approach. Instead of offering this sort of focused psychological therapy, they instead just offered a rest space. My understanding of the papers is that staff could actually stay there as well in terms of overnight. But in this space, there were counsellors available. So if staff wanted to talk to someone who was trained in, I guess, sort of more emotional matters, then that option would be there. The staff were offered food and practical help, which they had highlighted as being important, and there's support given in how those members of staff could keep in contact with their families, particularly if they weren't going back and seeing them, and some training was offered on how staff members could actually help some of their patients who were showing signs of psychological distress. And that was very successful. A very similar, so the approach we're using at King's at the moment, which has been set up by the adult psychiatric liaison team, is likewise we have set up a central staff support hub. It's not an overnight thing. It runs across the day. It's encouraging a peer support model. So it's basically encouraging staff members who are dealing with patients day to day to talk to themselves as a first port of call in being able to sort of process some of those difficult feelings. However, like the previous study, some support staff were available. So there are clinical psychologists who are on each shift and also some chaplains. And they're offering sort of more informal conversations and also a bit of structured support in the face of sort of relaxation and mindfulness exercises. And the model is really psychological first aid rather than therapy. So psychological first aid is an approach that is used when people have experienced a traumatic event, and it's more really to sort of give people a space to talk if they want, but if not to talk, just to actually be, and just really to have any sort of immediate needs met that they might need, and just a space to really decompress. There's also planned to then try and start offering some sort of video and face-to-face individual support sessions which people could access as they request, and some self-care information has been written and distributed. And that sort of advice is just to sort of frame all of the emotions people are having as actually being completely understandable and normal reactions to an extremely abnormal situation. And by that, normalising all those feelings of being really fearful, being overwhelmed, being hopeless as very typical reactions to what's happening at the moment. Encouraging people to connect with their social circle. Again, with peer support, that would be colleagues, but also friends and family, even if that needs remote means. As much as possible, trying to maintain normal daily routines and enjoyable activities, and to try and sort of maintain a healthy diet and sleeping as well as they're able, and avoiding alcohol and drugs as a way of coping with the emotions in the short term. And the advice in the model generally expresses that whilst this doesn't apply to the mini debriefs at the end of every day, sort of formal psychological debriefing in the moment of crisis when things are still ongoing can actually be unhelpful. And really it's a case of using this psychological first aid to sort of help people through the crisis. And I guess letting people know that often the emotions they're experiencing will start lessening after the event. But and usually we say that there's a period of watchful waiting for about a month or two. But then, of course, if some of these thoughts and feelings and difficult reactions are persisting for over a month, then that might be the time to actually start wondering whether or not to access help. This here is a very good document written by the Intensive Care Society. It's quite big, so it's written for service providers and managers on how to look after their staff in these sorts of crises. And I'm just going to look at the phase we're in at the moment. So we would be in the core phase now. So some of the things, if you are in the position of making these sorts of decisions, to make sure as management you are visible and available, that you're in it as well as everybody else, to keep the staff regularly updated, and to promote peer support, as we've said, but also, and I really can't stress this enough, to actually model that it's okay to be having these difficult thoughts and feelings and to be feeling overwhelmed. It's okay to sort of express that actually this is a really emotionally difficult time for me as well, just to sort of park it there and then to sort of go ahead with your day-to-day activities. As I said, small debriefs obviously are different from the big formal psychological debriefs and can be helpful. If you can, make sure that inexperienced workers are sort of buddied up with more experienced colleagues. And if you can, rotate staff members from sort of more high-stress activities to less high-stress activities so they get a relative break. That can be really helpful as well. And as we sort of mentioned in our King's model as well, just making sure that basics like breaks and food and facilities and a space to decompress is available. But also, so that's how we can manage the emotions of the staff group at this time. Of course, we are all staff as well, and we're staff members, but we're also members of the general population, and I'm sure we are all struggling at times with feelings going up and down. So I just wanted to sort of end on a little bit of stuff that maybe we can take away for our own self-care. And even though this is a repeat, I can't stress it enough, to try and accept that all of the sort of difficult feelings we're coming up with, these sort of ups and downs, the cycling of those feelings, are really typical responses to an unprecedented and incredibly challenging circumstance. And because of that, when we are noticing that we're having strong reactions, to show ourselves self-compassion. It's okay to feel like that. All of the thoughts and feelings we're having are completely valid. And also, when we have those difficult feelings, we have a tendency to sort of try and push them aside, to just throw ourselves into sort of really deep distraction. Sometimes distraction can be helpful, but what happens if we push our thoughts and feelings away almost too much is there's a risk that they will then sort of come and bounce back even stronger. And the other thing to do is if we are having these difficult experiences as well, to try not to feel bad about having them. Because if we start almost feeling anxious about having higher anxiety, then we start getting anxious about our anxiety and it spirals, or getting angry about having our anxiety, or getting sad about having our anxiety. So it can become a bit of a vicious circle. So just sort of acknowledge, that's my feeling. Hello. Sometimes what I find helpful is almost to say, like, hi mind, I notice that's a difficult thought you've just thrown in, or that's a difficult feeling. I'm noticing you, but now I'm going to sort of draw my attention back to what I can control and can do. And I think being able to acknowledge what is within our control and what's not is really helpful. This is a really nice graphic that has been, I think, shared amongst the general population. So as a professional group, some of these things might not be such relevant worries to us. We might not necessarily be too anxious about the amount of toilet paper at the shop. But even if some of those things don't quite seem like the things you're worrying about, I think that model is really helpful to actually think there are some things I can't control. So actually focusing on those isn't serving me or helping me. What I will draw my attention to is the things that are in my sphere of control. In terms of other ways of managing those feelings, a little bit like what we were saying about peer support, to keep talking to those who are important to us. I think one of the good things about peer support is, obviously, while matters of confidentiality are always going to be there, there might be more you can sort of share with the colleagues who are working alongside you. And also there's a shared understanding that you all get it because you're all in the same situation. But I would say that even in your more personal relationships, obviously there might be big chunks of things you can't say, but it's okay just to say, I had a really hard day today and I can't talk about it, but I'm feeling X, Y, or Z. For those of you who have found particular stress management techniques to be really helpful in the past, I think this is a time to take a breath, to sort of think what's helpful and then to try and use them again, but to do that quite lightly. Obviously, for example, people who use exercise a lot. There's obvious restrictions at the moment and how much we can do that. Also, some of the strategies you've used in the past might not quite feel so relevant for what's happening at the moment. But I'd almost say at first, don't let that put you off before you've tried. Try it, and if you're finding it's helpful, then that's great. That's something else in your repertoire. But if not, that's okay. Just sort of, you've tried it, there will be other things out there. I think staying focused in the here and now can be very helpful. So what I mean by that, and I have written mindfulness there, I imagine that some of you will have tried mindfulness in terms of the sort of more traditional meditations. I'm sure some of you would have really quite valued that. I'm also sure some of you might not have got on with it or found that it wasn't something you could focus on or it didn't feel helpful. I'm going to be completely honest as well. For me personally, I find that those long sort of traditional meditations aren't really my cup of tea either. But what mindfulness can be really helpful is sort of drawing you back into the here and now if you're finding yourself being very absent-minded or your mind's wandering or you're just finding yourself being sort of quite anxious or overwhelmed by difficult emotions in your day-to-day life. I mean, for example, if you sort of find yourself brushing your teeth and automatically your mind is sort of tracking into what you've got to do at work that day or what happened at the shift last night, just notice that's happened gently and again with self-compassion, but then just try and actually gently bring your attention to what you're doing in the here and now. So in that instance, it would be brushing your teeth and really trying to sort of bring your attention into what the toothbrush might feel like in your hand, what it feels like against your teeth, against your gums, almost being curious, like this is, almost like you're an alien who's never brushed your teeth before. What would you notice if this was a completely novel experience to you? And it's not pushing away the negative thoughts and feelings that have happened. It's acknowledging them, but it's bringing your attention back to something that's very much happening in the here and now. And I'm sure some of you will have already advised some of the families we work with that checking the news constantly isn't helpful. Actually, limiting checking can be helpful. Now, some of us won't be quite in that luxury, particularly the people who are helping sort of devise the overall plans. We'll have to be keeping on top of things quite regularly. But if there is any way that you can actually give yourself breaks from sort of checking those updates or delegating it to colleagues, that potentially could be really helpful in just giving you a small COVID break. And also, this is just something that I've been reflecting on in the last sort of week or so, as a lot of us are moving more to sort of remote home working. And sometimes it's really difficult to actually set the boundary of this is where I stop for the day. And I'm sure that's going to be having an impact on a lot of us on being able to actually take some of that time we need to look after ourselves. So perhaps just sort of being mindful of if you're working over your hours, just to think, is there a time when I need to do a cut-off and actually think, no, this is going to be my space at home. And very finally, I've been, despite what I was saying before about how actually sort of formal therapy not being sort of that helpful in the midst of a crisis, I guess as I've been moving on, I've been doing more, I'd still call it psychological self-help, but we are getting more sort of therapy type based. And I'm not going to show this video here now, but I think there's only one more talk afterwards. What I'd almost suggest is if you'd be interested in looking at a very basic set of strategies. Again, it's not exploratory therapy. I think it's absolutely fine for all of us sort of dealing with things in the here and now. It is something using the ideas of a therapy called acceptance and commitment therapy. For my asthma colleagues, the acronym for that is also ACT. But Russ Harris, who's one of the big names, has basically devised a set of strategies for helping us actually deal very specifically with COVID anxiety. So Face COVID is an acronym and each of those is a strategy. There's a really nice video which you can go to on that link there. Also, if you just search for him, I think there's a PDF there in the public domain as well. If not, if you want to email me, my email's on the next slide. I can sort of send you that, and also anyone who wanted the intensive care document about how to support staff, I'd be really happy to email that to them as well. But I really would recommend, if you've got the time and you're willing to do it, just to sort of spend 5 minutes just having a look at that at the end of the day. And that is the end of this.
Excellent talk.
Problems.
Excellent talk. Thank you very much for putting that together. I wonder whether we let Suja do her talk now, and then any Q&As come back to you and Suja together. So Suja is talking about positivity, so calm during the turbulent times. Suja is a senior pediatric social worker at King's College Hospital, and she has done a lot of work around positive thinking and a lot of work associated with multiple charities in UK and abroad. Suja Chandran.
Hello, everybody online and across borders and limitations. Thank you for prioritizing calm in these turbulent times. I've been quite humbled in the last few weeks about looking at how families, how colleagues everybody has in some way or the other prioritized calm. I work as a social worker for most part of my adult life. And most part of it is to do with containing anxiety, containing uncertainty. But it does feel quite unusual times now. It's quite unsteady. There's a lot of confusion. There's mixed messages, mixed capacities. I was off social media for some time, and then I quite quickly came from detox, media detox, to information overload. So there is a lot of mixed messages. So how do we prioritize calm during these times? So with each wave of news about the potency of the COVID infection, also came another wave, how to manage it, how to manage fear, how to manage anxiety, how to look at what's working and what we can do. So if a problem was presented, so was a solution. But of course, we are in the midst of an unprecedented problem. And there are lots of distressed people who need reassurance. So just as turbulence is a reality, being calm is also a reality for many. So the thoughts I'm presenting today is from a charity that I volunteer with. It's called the Janki Foundation. It's a UK-based charity promoting the integration of spirituality into healthcare. It supports healthcare professionals through value-based dialogue and training and education material, and also provides financial support to a hospital in India. So the thoughts that I'm presenting today are from the resource material of Janki Foundation, which is a UK-based charity looking at education material to integrate spirituality into healthcare. Primarily, it is from the Values in Healthcare program, which was a beautiful resource that was created in 2004, and it's used by several hospitals, and it's now across the world. So it's not that I'm going through the modules that we have, the 7 modules, but some of the information and some of the experiential resource that's coming through in this presentation is from here. So as you can see, they have 7 modules, and then through that, they go through different spirituality tools. The other resource is an app which was created just by the end of last year called Happy Dode. It's again created by multi-professionals, and we had sat together as an MDT would and looked at the possible scenarios that come about while working in a healthcare setting. And we came about 10 scenarios, and there are simple guided meditations that you can download. So you can download this app onto your phone, and it's a free app. It'll always be free because that's the whole idea of the charity, that they want to provide free resources. So what is being calm? It's an internal experience, not just an external experience. When we say calm, there are a whole lot of words that come to mind: peace, tranquility, restfulness, serenity. A lot of these words automatically, the way we think about it, the way we say it, we automatically have a sense of calm. So being calm benefits our physical, mental, social, spiritual self. There is a sense of positive attitude that you develop. Because what essentially you're trying to do is you value yourself, and because you value yourself, you're able to value others. There's a great energy, there's a satisfaction, there's enhanced clarity in decision-making, an increased sense of well-being, improved relationships. Now, all these things are obviously quite useful in this unprecedented time. Some of the experiential tools that we will try and explore through this presentation is reflection, visualization, appreciation, and meditation. And there are far more other experiential tools, but this would be something which we could easily look through as part of a presentation. So when we experience tranquility, we have a better sense of how to cope with anxiety, how to cope with fear. So when we reflect on it, what is reflection? It's you take a moment of calm, you have a detached view of yourself, you examine yourself, your emotions, and then you're able to release some of those difficult emotions because you've taken time out. And it doesn't require lots of time out, even 5 minutes is time out. And the other tool is visualization, where you use the mind to create a positive image, to develop a positive attitude. So there are lots of beautiful images that we have, which we can create, we can just sit with, and then you suddenly create a different atmosphere in your own head. And appreciation is a great way to draw on, the existing strengths of yourself and people. So, it's a good way to seek solutions and to show value for your colleagues. And meditation is being silent to learn about mind and thoughts through positive and peaceful thoughts. What is SOS? S is to stand, separate yourself from the influence of your own thoughts. You observe it. You can decide what you want to do with it. I think there's a lot of benefits of having an observation of your own thoughts. And once you've stood back and once you've observed your thought, what does help is it helps you to move away from a negative thought and create a positive thought. So practice SOS. Stand back, observe, and steer. So it's a simple imagery that's given as, okay, there's a fire. You don't jump into the fire. You stand back, you observe, you find a way in whether you deal with the fire or you run away, find some time, and then come back, deal with it because you've got some water, you've got other things to extinguish the fire. So that's what practice SOS helps. I'd like you to take a few moments to look at reflection. And why is reflection important? Because it's important for us to raise a few pertinent questions and give ourselves time to answer it. When we are in such turbulence, what often happens is a lot of questions. We give ourselves time either to hear our own answers or some kind of wisdom or so there is a reactionary mode that we get into. So I'd like you to take a few moments, identify your positive qualities and thoughts. And you don't have to think too much about it. You can be quite spontaneous about it. So what qualities have I shown today while talking with others? What are my good qualities that I observed? What positive thoughts do I have about others? How did I see them? What positive thoughts did I have about myself? And what have I done well today? I think a simple reflective question, any one of these questions, if you just simply spend 5 minutes just looking at it, it has this ability to ground you and to look at, oh yeah, I've done that, I've achieved that, and I think that's good, and I really like myself doing that. The second tool I'd like you to think about is visualization, and we often do that because a lot of times we have images and images of calm, images of determination, of peace. We do have that. It's sometimes good to just zone into that. What are your images of calm? I have a few. in these times, these three images have really stood out for me. One's of a boat. A boat can safely sail through choppy waters. It's fine as long as it's sailing, even if the water is very turbulent. What needs to happen is, and what you need to be alert is, that the water doesn't get into the boat so that you can continue sailing. And that's what we need to just watch out for our mind, that things don't get so heavy that we're quite drowned by it. Whereas if we're not, and if we've got some few good practices, then we can just sail through some of these choppy waters quite safely. The second image that comes to mind is a lighthouse. The fact that it is present, it's steady, it is a very reassuring presence for ships. And what is it that we can learn from a lighthouse? And how is it that we can be there for our colleagues or for our patients? How is it that we can give reassurance? What is it that I need to do to enable that every day, day in and day out? Another imagery that is really useful is to look at an eagle, because an eagle does not escape the storm. It uses the storm to fly higher. It almost likes the challenge in a weird sort of way. You find a lot of other birds will go and hide themselves, whereas an eagle will go up higher and ride the storm. So that's a useful image. And one of the things about any of these visualizations is that you can practice that sense of calm in any other place, any place. You could be just sitting with yourself. You could be sitting suddenly in a meeting, or suddenly between patients. You have 2 minutes, 3 minutes. You can immediately zone in to an image which reminded you of being calm. The other beautiful aspect about appreciation, which is also a very useful tool, and the more we appreciate, the more we start seeing possibilities in people. So it's good to practice giving appreciation. And we were doing it with some friends to begin with, sometimes with people who you struggle with, but it's good to start with people you love. You can be sincere, you can be specific, and identify their qualities. What is it that you're appreciating? Because that's the sincerity. What is it that you experienced? Because if you're talking about calm as an experience, not just a gesture or not just something which is external, then if you've experienced either their gentleness, their kindness, probably their assertiveness, their enthusiasm, their clarity of thought, their determination, the fact that they can be calm. So it's always good to just talk about appreciation in its own right, without any spoilers, without having a but by the end. You know, it's like when we give feedback, it's always good to just talk about, I like this and this and this, and period. It's great. Just sit with it. You don't have to say anything more after a good appreciation. Another very important tool is meditation. And there could be people who have tried meditation, and there could be ones who probably are hearing it for the first time or had it in mind. What would be useful is for you to download Happy Dot, which is an app, and it's a free app that you can download. It gives some really practical, simple advice, simple guided meditations to help calm your mind. It should be calm your mind, not calm your mind, and soothe the stress of work. It has 10 scenarios commonly faced by health professionals and carers. So I'll encourage you to look through those scenarios. What does meditation help with? Meditation really, so our thoughts are constant. We create about 50,000 thoughts at any point of time. That's kind of the speed at which we think. And meditation helps you calm down, slow down, and look through some of those thoughts and create an affirmative, positive thought. And through that, we are able to then look at changes that we need to do. So it's a really good inner resource. And yes, and it helps you to go inward. It helps you to look at who you are. And it doesn't mean that you have to sit in meditation for long. Most of the meditation commentaries are not more than 5 minutes in this app. So shall we have a go with one of the meditation commentaries? So let's have a go at one of the scenarios. And the one which I would like to pick is unsafe and surrounded by chaos. Meditation. Let's hear it.
I take a moment to sit down quietly. I want to make sense of it all. I want to find meaning beyond the storms of the dense fog of the words and the actions that whirl around me. I talk to myself gently. Come, let me try and step back a little and breathe slowly so that I can see things a little more clearly. I settle gradually in my own sense of calm. From this quiet place, I am able to observe that as much as I want to, I cannot control everything around me. I choose to stay inside the protective shelter that my inner calm has created. I am moving to my center of stillness, that part of me that is trusting and certain. I step inside to meet my quiet and peaceful self. From inside this safe shelter, I'm able to see more clearly. When people are at cross purposes, they are often communicating their distress. What I can do is try to discern their underlying intentions and needs. I am able to appreciate their strengths and allow myself time to be patient. I send them good wishes of hope and tranquility. My good intentions are carried like a calming breeze, filled with loving kindness that energizes and stills. In this quiet connection, we are feeling safe and secure. We have gently moved from chaos towards our inner center of stillness and peace.
Thank you. I hope you like that. And certainly I feel a bit more calmer. So thank you for your time and take care of yourself. If there are any questions, you're more than welcome to send me an email. If there is any resources that you would like to look through, browse, please do let us know. And stay safe.
Thank you very much, Suja and Faye, for excellent talks. I think we are open for any questions for Faye or Suja. Has anybody got any questions? How do you support the staff on daily basis? So I presume this is very similar to what you said, Faye. Do you want to summarize that?
Do you mean how do we support our sort of fellow colleagues on a day-to-day basis, or how managers do that, or how, I guess, sort of psychosocial professionals do that?
I think it's probably as your fellow colleagues.
I think as I said, I think modelling that you're not feeling great as well, I think can be really helpful. I think often we get these situations where, and I think particularly in healthcare as well, when we all sort of do a lot of sort of trying to be brave and soldiering on, I think a lot of the time people don't feel that they can actually share their feelings, and we know that actually just the act of sharing can sometimes be enough to sort of feel heard and feel not alone, and that in itself can help promote resilience. So I feel if people feel brave enough themselves to express some of the things they're going through, some of the ups and downs they're having, that, you know, just actually, even if you don't want to go too personal, just acknowledging that actually things can feel a bit of a struggle at times. I think that in itself can be really helpful as well. And then I think it's a bit more on a sort of ad hoc basis as well. I don't think anyone is expecting all of us to, I guess, sort of, you know, have to sort of do a specific intervention or something. I guess if you happen to be the person with a colleague when that colleague wants to express something, I'd just say just sort of listening openly to what they say just can likewise be really helpful. Asking, is there anything that could help at this stage? Obviously, in some situations, like a manager might have more within their control that they could do to help. But, you know, I think it's a lot of it is just sometimes feeling heard.
Thank you, Faye. I think this is probably for Suja. What we have to do if we cannot stop thinking about the others safely affecting our daily routine and sleep.
I'm going to step in for Suja here. She's having some technical difficulties with her iPad. I believe she's going to have a go at just trying to find the link again in her email to reconnect to the call. But perhaps we could direct another question to Faye.
Yeah. I think the Faye, so going back on the question again, so a lot of doctors are doing shifts of 2 weeks on call and 2 weeks off, and how do they manage that amount of shift work in such a turbulent time?
Yeah, and so because obviously I'm not a doctor, so on the weeks of on call, what in terms of would that be looking like in terms of hours worked, and is that like no days off at all for those 2 weeks?
Yeah, so I think a lot of people are working 2 weeks continuously and then 2 weeks off, and that give them a chance to break. And so I think how do people manage the 2 weeks when they're working together?
I think self-compassion, knowing it's going to be tough and allowing yourself to actually be kind to yourself when you're finding it tough would be helpful. I think finding brief moments to be able just to, going back to the mindfulness thing, when I think people talk about mindfulness, it's not necessarily being able to sort of sit down and do a 10-minute meditation, although that can be very helpful as well. Sometimes it can just be very grounded activities. So one really sort of simple one is, it's called 5-4-3-2-1. You first of all just acknowledge the sort of difficult thing you're feeling at the moment. So it might be in this sort of situation feeling really overwhelmed, or feeling that feeling like you're being made to make very difficult decisions, and whatever feelings would come from that. So acknowledging that, and then it's not pushing those feelings away, but then gently bringing your attention to what's going on around you and identifying 5 things you can see, 4 things you can hear, 3 things you can feel. So by that I might mean sort of sensations of sitting down, or the clothes against your body, or even any physical discomfort. I think a lot of the time people think that mindfulness is all meant to be sort of very relaxing and pleasant, and actually sometimes it is just acknowledging what's difficult in the moment. And then the next 2 can be a bit trickier, but if you can sort of see if there's 2 things you can smell, 1 thing you can taste. But it's just really a way of bringing your attention to things that are happening very much in the here and now and outside of your headspace. I mean, talking to colleagues as well, I think would be a really useful thing for those difficult moments. And also acknowledging that there are colleagues who are in that same boat of them. I think just in itself that can help not feel alone. And I think I would also encourage people that I know that probably nobody feels like they can talk to a manager or a more senior clinician at the moment because we are all struggling. But actually, if it is getting to the point of feeling overwhelming, I would encourage people to have those conversations.
Thank you, Faye. Now that I can see Suja. Suja, there is a question for you. What can we do if we cannot stop thinking about others safely and which start affecting our daily routine and sleep?
Yes, it's a good question. I think our thoughts will continue. You can't stop your thought process, right? So it just depends on what kind of direction we can give to our thoughts. So it's not meant to, so if you are worried about somebody's safety, that's quite a valid, quite a genuine, quite an integral part of your system. It's about how you dip into your reserve, your emotional resilience. Is there a possibility to do that? And it's almost like it is quite difficult when we are quite worried, and it's quite difficult. But there is also another, I just want to read out one of our group members is a GP trainer, Dr. Arnold Desser, and when I just happened to email him saying that I would be doing this. We did this as a short notice. And he said that breathing is a really good way, and also all the kind of different types of breathing that people are saying, deep and circular breathing and all that, may be difficult, but just doing diaphragm breathing, in terms of, and even if you just do it for a minute and you do it through the day, it just helps you to immediately ground you and calm yourselves down a little bit. And then you can work on your thoughts, because if we are constantly in a reactive mode, it's very difficult to actually look at what our thoughts are saying. We are reacting to what the thoughts have taken over. We are not in control of those thoughts. So it may not be a great answer, but there are quite a lot of benefits of practicing calm in some ways. It's a practice. It's not something we're born with. Sometimes, people say you have to work at being happy. You're not automatically going to get happiness. And it is a daily practice. Similarly, in these times when we know we're going to be anxious, it's quite natural. We know anger is taking over, fear is taking over. Then you also have to almost have an immediate practice. How do you counter that every day? And then whatever works for you. So it's about figuring out what exactly works for you from some of the things that we've spoken today, and just doing that, go with the known, and then you will slowly progress to something that is completely unknown. And a lot of things are unknown right now, but we know certain things about ourselves. We know what works for us. And we zone into that and then build on that.
Thank you. Thank you, Suja. I think this is for Faye. Faye, is there any specific techniques to help patients going through the psychological issues? Example, maybe a teenager which is very anxious, been admitting with a life-limiting condition.
Okay. I would say that sort of a lot of the things that were in the second part of my presentation, I think are absolutely applicable to a lot of our patients and families as well. In fact, I've been using quite a lot of the ideas with sort of specific families I've been working with. In terms of something that, I think part of the problem we're all facing at the moment, and I think particularly people like the young person mentioned, so a young person with a life-limiting condition, I think it is that sense of uncertainty. And we know that actually sometimes it is almost easier to cope with a known bad thing that's going to happen than actually the uncertainty of how bad is it going to be? Is this going to affect me? Is it not going to affect me? And so going back to that face COVID thing I had at the end, or acceptance and commitment therapy in broader details. Certainly as a paediatric psychologist, over the years I've used more and more of those sorts of strategies with our families, because I think unlike other types of therapy, they really are about being able to embrace and acknowledge that uncertainty and not pushing it away, not trying to find a certainty, but be able to sort of sit there with that difficulty, but still be able to think, well, what can I do and what is meaningful for me, and therefore being able to have some sort of quality of life. Even though the thoughts and feelings aren't going to go away, they can just be learned to be sort of managed and sat with a bit more.
Thank you, Faye. I think we probably take this as a last question. How can a junior doctor handle the seniors facing job insecurity, and how can we communicate with them?
So in terms of job insecurity, in terms of employment not lasting, or what the job's going to look like?
Probably, I think, is the job going to look like that we are more likely to be deployed, so they may be moved to a different part of the areas which they are very uncomfortable with.
Yeah.
And
And again, I think that is a very anxiety-provoking thing for a lot of people in the NHS across a whole range of conditions. I think the thing is with anxiety is that we're never going to have a situation where we don't feel any anxiety. And in fact, anxiety from an evolutionary perspective is there for a reason. It sort of goes back to when day-to-day life, when we were cavemen and cavewomen, was sort of very dangerous essentially, and you needed an alert system for, here is a danger approaching me, I must act in a certain way. And I think that sort of anxiety, that response still happens and is an incredibly sort of worrying time. I would almost say that to accept the anxiety as being there, sort of not to feel bad about it, but then also to, if everyone can remember the slide about focusing on what's in my control and what's not in my control. Obviously, redeployment in the future is outside the sphere of control, and then if it happens, obviously, then that will be dealt with. But for here and now, while it's just something in the question, to just sort of acknowledge it's a worry, but then try and bring your attention back to the things that are in your control in the here and now.
I just want to add to that. So we are talking about big changes, and change is never comfortable. And any change, any changes that we've had in our lives, if you just go back into your own life history, every time change, what was the kind of response that we had? So change is going to be uncomfortable. And what we are expected to do is unprecedented changes. People don't know. There's a lot of unknown happening every day. So one of the things is, is there like what Faye said, is there a possibility to look at acceptance that we have the COVID, we can't do anything about it. It's not something, how it came, what it came, it is here. And is there a possibility to have some kind of a balance? So insecurity is high, fear is high, unemployment, the prospect of unemployment is very high, the prospect of losing everything that we have. Because that's what, as a social worker, that's what I'm hearing from stories. I think it's a dual story. One of the fact that, okay, I don't know how I'm going to feed my family after this time. And the other aspect is that we will go through this. We have to go through this. We have to find a way. So is there a balance of looking at that insecurity? But I think just to have that sense of reassurance, a presence of reassurance really helps, especially if you're talking about colleagues. I thought the question was about colleagues. And it's not about hierarchy. It's not about who's where. It's about your inner power right now. And I think the ones who can rise to this challenge is ones who have got that resilience and is able to support. And there's a lot of cooperation that's needed amongst colleagues at this point of time. And some people can do it, rise to the challenge, some people can't. And I think it's almost like just supporting the ones who can't and being a role model for some people. So it doesn't, I think the one thing about something like this is it's quite a leveler, isn't it? Everybody probably in the social hierarchy has got it. Everybody is in the same boat. because we're all worried about our families and what will happen to us, what will happen to our patients, a whole lot of things. And it kind of blurs personal, professional boundaries in a lot of sense. But there needs to be some time spent with yourself to reassure yourself that you'll go through this and you will be able to be of support to colleagues and have some sense of balance of this fear and alertness and a sense of reassurance. We need to have a balance. We can't have too much fear because we can't function. And we can't be too laid back because then we won't be alert to what's coming. So it is tremendous change, and change is difficult. But there is also, as human beings, there is so much potential that we don't use, and probably this is a time for us to dip into that potential that we even don't know that we have it.
I think just reflecting on a lot of what of our families, our parents say of our patients at the really difficult times, is actually through the really difficult times, they almost actually find those energy reserves from somewhere to propel themselves. And actually sometimes it's a crash happens afterwards. And I'd expect that actually certainly quite a big proportion of the staff group are going to be finding that as well, actually, that somehow when they're in it, actually they will find those reserves, they will get through. And I'd almost say the thing then to be careful about is when the crisis sort of starts to abate, just it's really important to carry on looking after yourself in any way. I think, if nothing else, it's just really, if everything feels very paralysing at the moment, I think it is just sort of focusing on, right, well, what's the next best thing I can do now, and just sort of break it down to, each day, even each hour if you need to. So rather than sort of tracking ahead, thinking like, what do I need to think about right now? For those people who have small children and have seen Frozen 2, there is a song that I think completely sums it up, I think called The Next Best Thing. For those of you who don't have children, I'm sure you can find it on YouTube. Again, I'd recommend having a look up, because I think, it is just a really sort of a helpful way of looking at when you feel completely overwhelmed. Actually looking at the grand picture is not going to help that feeling of overwhelmed, but by just focusing on what's right in front of you, what's the task you need to do next, that can sometimes be helpful.
Thank you, Suja and Faye.